Hi, my name is Edwin, and I'm doing the tracheostomy care skills video. There's a remediation. The reason I'm doing the remediation is because I had my wedding ring on. Totally forgot about that. But I am in my Nightingale uniform. I got my badge. I got my patient, my gloves. I got my tracheostomy clean care tray. So before we start, I'm gonna make sure that I introduce myself to the patient. I identify the patient using the two patient identifier, and I explain the procedure to the patient, and I provide privacy. Then I'm gonna raise the bed to a working position, to a comfortable working position, and I'm gonna put the patient in a Fowler's, semi-Fowler's position. I will perform hand hygiene, put on my gloves, and then next, so for this part of the procedure, I'm gonna make sure that I remove the oxygen source. I'm gonna remove the oxygen source, and then I'm gonna remove the dressing that's on there. And I'm also gonna provide suction if it's needed. So for this procedure, you would usually need two people, unless the patient is alert, oriented times 4, then they could help towards the end by holding their trach. But I've already provided suction if needed. I'm gonna remove the oxygen source and remove the old dressing. And then at this time I could inspect too to see if to see the stoma, to see if there's any wound care needed. So now I'm gonna remove my gloves, perform hand hygiene, open up my kit using the sterile procedures. I'm gonna move this to the side. I got my sterile gloves, which we'll put on. I will use my sterile drape to put right here. And then just touching the edges of the box, the 1-inch edges, I'm gonna discard and put all my supplies here. We can move this. Let me see, put it right here in front. So, or come around it. Keep this in front of me. So in one basin, I'm gonna put hydrogen peroxide and normal saline solution. In the other basin, I'll put normal saline solution. Now, applying my gloves. Stand up for this procedure. Slide this to the side a little bit. Just touching the 1-inch margin. Open up my gloves. Dominant hand first. Hands above the waist at all times. Then use it 3 to 4 fingers. All right, so now gloves are applied. I'm gonna grab it from the middle, discard to the side. Hands are still above my waist, maintaining sterility. Next, I'm gonna unlock the cannula from both sides, and I'm gonna pull out I'm gonna pull out the cannula, following the curves, and I'm gonna place the cannula inside the saline mixture solution. I'm gonna take this is my I'm gonna take the wire brush and scrub all around, and I'm gonna place it in the I'm gonna place the cannula inside the normal saline solution. At this time, I will take my cotton swabs and dip them into the normal saline solution, and with the cotton swabs, I'm gonna clean the stoma on one side, discard. Clean the top, discard. Clean the other side, discard. Clean the bottom, discard. And then I'm gonna clean all around one more time and discard. Next, I'm gonna pat dry using a gauze all around. Pat, 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 lift, pat, 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 dry, pat, dried, discard. And then I'm gonna insert the cannula back in place. At this time, I'm also looking to make sure that the stoma is clean. There's no redness, no abrasions or anything. I will replace the old gauze with a new one. And once that's done, now I can replace the necktie. This is where we would have another person assist, or have the patient assist you by holding on. When we replace the tie around the neck, we want to make sure that when we put it back on, there is no bends or twists on the tie, on the tie. So now that we have the 4x4 on, we apply. Like I said, we go around, we make sure that it's not folded or bent anywhere, because this will cause irritation, skin breakdown, which is something that we always try to avoid on our patients. When we tie it, we're gonna come around to tie it. We'll tie it to the side, and when we tie it, we'll put some tape around it. That way, when it comes around, all right. So next, like I was saying, once we're on the knot, we will put some tape around it. That way, the patient, the knot doesn't, or the bow tie does not irritate the skin. Now we're finished. We get rid of all our trash. The procedure's done. We lower the bed, put the patient at the safest position. We give them the call light, make sure that they're okay, do ask them if they need anything. We discard our gloves. We perform hand hygiene, and we document our procedure. And like I said, there's a remediation because I had jewelry on. My ring is off this time. And that is it.